We're heading into what many consider the best time of year, not because of the weather, but because of the sports that come with fall and winter, like football, soccer, skiing, and snowboarding. EvergreenHealth emergency care physician Dr. Sarah Gartner joins me now with more on how to stay safe while playing sports, as well as what injuries require emergency visit and maybe some that can wait.
Yeah,
so, this
you.
is good information to have. You're seeing a lot of sports injuries, I would imagine, right now.
Yeah, definitely. I think a lot of times in the fall, we see a lot of sports that have a lot of high impact. You know, that's the nature of the sport, unfortunately. And we hope that nothing bad ever happens, but if it does, we want people to know when to seek care and what time frame to seek that care.
I think that's important. I know one of the big injuries that's common would be something associated with football, like the head and the neck injuries.
Correct, yeah.
Does a concussion always require an emergency room visit?
Yeah, great question. So it depends, I guess. That's the easiest way to say for it. Concussions can be very mild, and they can also range all the way to very severe symptoms. I would say most mild concussions have some headaches, some nausea. You'll notice some light sensitivity, and you might notice that your symptoms get worse when you're like looking at a screen, for example. But symptoms that are more red flag that would concern me that someone should go to an emergency department would be really bad, severe headaches. If someone lost consciousness after they fell or had an injury, if they had multiple episodes of vomiting, if they were confused, you know, that athlete just isn't acting normally to you, or if they're having difficulty walking, I think those are all real important reasons to come and seek care sooner rather than later.
So I have had a concussion where I felt that the mild that you talked about, it got worse because I kept looking at screens and things like that. But so if it's in that mild, you don't need necessarily to go to the emergency room, but as you're saying, confusion,
exactly.
vomiting.
Even like vision issues, or if you have any concerns, obviously come and see us.
And I know concussions aren't the only thing that can happen with those high impact sports. What other neck injuries maybe concern you that should be seen emergency room versus, say, urgent care?
Yeah, so a lot of times if you have bony or like spine tenderness, so the middle of the neck tenderness, again, any numbness or tingling to the arms or legs or difficulty walking, if that athlete has difficulty swallowing or speaking, I'll definitely come and see us sooner rather than later. But otherwise, you know, and I will say, like, say you're watching a sport happen and you have an athlete fall, if you have no medical personnel, make sure that family or coaches are putting that athlete flat and calling 911.
That's good to know.
Right? This is not an athlete that you want to just pick up in your personal vehicle and take them to the ER. It's someone that you want EMS there so they can stabilize the spine and make sure everything is safe for transport to an emergency department.
What other injuries maybe require an emergency room visit? Maybe not associated with head or neck versus waiting or urgent care.
Yeah, for sure. So we see, you know, a broad range of injuries. One that we see a lot is chest wall injuries specifically. So, you know, if someone gets, you know, tackled in football and has some chest pain, if that chest pain resolves and you ultimately feel better, you know, you take some Tylenol, ibuprofen, things go away, that's okay. Follow up with your urgent care, primary care doctor. But if you notice that chest pain's consistent or it's associated with difficulty breathing or other symptoms like that, or again, the mechanism was quite severe, definitely see an ER and an ER doctor.
And I would imagine, we talked about skiing and snowboarding in the beginning, I would imagine those kinds of injuries can happen on the mountain like that too.
For sure.
The chest injuries.
Exactly. And then I would say the most common that we see is like broken bones or concerns for a broken bone, right? And I would say my general rule of thumb when it comes to broken bones is if there's an obvious deformity, meaning like that bone looks broken, you know, the bone is sticking out of the skin, come and see us, right? Or if there's significant bleeding to that you can't stop, or if the athlete can't use the arm or it's really hard to bear weight on the legs, those would be reasons to come sooner rather than later. But otherwise, you know, you can follow up at urgent care.
And I just have a minute left, but I did want to ask you this. What is the best way to advocate for ourselves and our loved ones in an emergency room situation? I know sometimes we go to the emergency room and they've triaged us in the sense of where you're going to be in the getting care, and we get frustrated. What's our best way to advocate?
For sure. It's busy in an ER, right? And people, you know, I guess emotions are high and it's hard, but I think come back to the basics, right? Like you are really concerned about your patient, your family member, your brother who's there, and advocate those concerns, right? That's what your doctor wants to hear, because that way we can hopefully alleviate some of those concerns and come from a point of caring to really get on the same page.
Okay, I like
and
that.
provide the care that you guys need.
Rather than screaming that I've been waiting here forever.
Right. Yeah.
Because you know how long I've been waiting.
I know,
right?
I know, and we wish we could see so many people so fast.
So
it's hard sometimes.
Talk about what I'm feeling, the pains, or my loved one. Okay, I like that. Thank you so much.
Of course.
And to learn more about Evergreen Health's 24/7 emergency care offered in 3 locations, Kirkland, Redmond, and Monroe, just visit the website on your screen.
This portion of New Day Northwest is sponsored by Evergreen Health.